Joining me on the phone right now on Indiana in the Morning is healthy living specialist Judy Gaman. And Judy, thank you very much for joining us.
Always a pleasure to be on with you. Thank you so much for the opportunity.
All right. So let's talk about the fact that the physical, we've had physicals ever since we were kids. For me, it was always a little scary going to the doctor's office. And it seems like with COVID-19, things have changed so much, and people are afraid to go into the doctor's office now for very different reasons, not just to discover the fact that they may not be as healthy as they thought, but COVID-19 may still be a very big presence in a doctor's office.
Well, that's true, but we have to remember that no one is more well-versed on prevention of COVID than our healthcare workers. And a lot of facilities are either dividing up the way they are bringing in well patients versus ill patients, or some facilities, like where I'm the CEO at Executive Medicine of Texas, we're a wellness clinic. And because our focus is on prevention, we know that heart disease, diabetes, cancer, all of these things do not stop or recognize a pandemic. They're still going on. Mm-hmm. So those are big killers. Yes, COVID-19 is a serious and deadly thing, but it doesn't take the place of all of these other things that we definitely need to stay on top of.
So what are some of the other reasons, I guess, then, that people are saying, I really don't feel the need to go to my doctor for a physical?
Well, because a lot of times you're asymptomatic when you have these things. For example, colon cancer, and I pick on colon cancer quite a bit because it's almost 100% preventable. And that's why, like in our physicals that we do, a lot of times we're doing these virtual colonoscopies. People can have optical or they can have virtual. But what we're looking for are any early signs of colon cancer. 99% of colon cancer starts as a polyp. You get that polyp removed, you never get the cancer. You don't feel a polyp. Most of the things that can really harm us, we don't have symptoms to. So saying, I'm always healthy, I never go to the doctor, is like having ostrich syndrome. You're just putting your head in the sand, and one day you may go, oh my gosh, how did I get this? I didn't know I had high blood pressure. I didn't know I had these things. And in a time like this, when we know that untreated heart disease and such puts you at an even higher risk for death from COVID, all the more reason we need to stay on top of these things.
So the annual physical is just as important now as it has been ever before because of the fact that we have so many people who may have these underlying qualities. So let's talk about how people can receive these physicals now. You mentioned the virtual colonoscopy, it sounded like. Are there virtual physicals?
Well, that's a really good point. I'm glad you brought that up because I have seen some talk of this, and I like to say this is almost fake news, right? I've seen a lot of this on the internet and circulating around. Just get your physical online. And that is just insane. We cannot perform the types of exams that are necessary when you're really, truly looking at prevention. Our exams, for example, last 4 to 5 hours. And I always say there are 3 parts to a very good physical exam. One is a look at the inside of a patient. That means, what do the blood levels show? What's going on if we do an EKG? What's that rhythm of that heart? If we do a CT of the abdomen, chest, and pelvis, is there any early disease happening? Again, back to the colonoscopy. Let's look inside. 2, let's look on the outside. And when we look at the outside of a patient, we're looking, are there any moles or anything that it looks suspicious? And it's not always skin cancer we're looking at. I tell this story often. We had a patient come in, had the same thing, never really go to the doctor, I'm pretty healthy. On exam, one of our physicians noticed that they didn't have hair below the knee on one of their legs and said, this is interesting. How long has this been? He goes, I don't know, I never noticed it. Turned out the guy had some problems with circulation in his legs that he didn't know about, had a clot going on. And so there are a lot of things that we need to have a trained eye. We need to have a really good physician looking at the body, looking at the inside, looking at the outside. And then the third most important part is listening to the patient. A lot of professors at medical schools will teach their students, listen to the patient. They're trying to give you the diagnosis. Not necessarily outright, but in the things they say, there's clues. It hurts when I do this, or I have trouble sleeping, or all these symptoms or clues to what the bigger problem is.
Mm-hmm. I did actually notice that third part, listening to the patient. In my recent physical, my doctor was asking me a lot of questions about my life and about how things were going. So I imagine I probably let a few things out that probably he would have picked up on should something ever happen, that there would be a medical crisis like a high blood pressure or diabetes or something like that. It's important to have that face-to-face conversation with the doctor or whoever's giving you the physical.
Right, and sometimes you go in and one question leads to another. We have a smart form that people fill out before they ever come to see us. It's 24 pages, but as you answer questions, say it says, do you smoke? If you say no, it doesn't give you any more questions about that. But if you say yes, how long have you been smoking? How much do you smoke? Do you vape? So it actually digs down a little deeper. And what we found is getting that information ahead of time, having the doctor look at the individual as a whole and say, what is going on in this person's life? Where does this focus need to be? It's hugely important to the success of staying young and staying well for years to come. Without digging deeper, it's just surface stuff, and surface stuff doesn't get us anywhere.
We're talking with Judy Gaman, a healthy living specialist, about why you should continue to get your physicals, even though that we are living in a time where things seem to be upside down and inside out. So we know that getting the physical every year, or in some cases every 6 months, may be probably the most important thing for a lot of people to keep in mind. So what do patients need to know about getting their physical? Say maybe they haven't been to their doctor in a few years, or they are going to a new doctor for the first time. What should patients keep in mind?
Well, first of all, not all physicals are created equal, and not all places that you go will call them the same. Medicare calls a physical, and I say that with quotes around it, when a nurse takes your blood pressure and asks you a few questions. That's a really too loose. That's like saying you have all these friends with their people on Facebook. So we really have to define what is a good physical. And when you're booking your physical, ask, how many blood tests are you going to do on me? Are you going to check my hormones? Are you going to be looking at other things? All this is very important. So know what you're getting into, one, and if it's adequate. Two, tell your doctor everything. Don't be afraid. If you do recreational drugs, or if you have something that you normally would be embarrassed to tell your doctor, maybe it's erectile dysfunction or you're having other issues, tell your doctor. Nothing is going to shock them. I always say nothing shocks God and nothing shocks the doctor. Trust me, they've heard it all. Tell them, because they cannot help you and actually help you live your healthiest and best life unless they have the information. The only way to get the information is to get it from the patient.
All right, Judy, thank you very much for joining us here on Indiana in the Morning, and we wish you all the best. Please stay safe, and thanks again for joining us.
Always a pleasure.